Well, first of all, let me tell you what Equity Healthcare is. So Equity Healthcare is a purchasing coalition, and it works with employers who have been purchased by private equity firms. So a firm like Blackstone, Bain Capital, TPG, Vestar, etc., will buy a company. The company could be a Neiman Marcus, it could be a SeaWorld, and my company, Equity Healthcare, will go in and manage their health benefits and healthcare costs. So what I have is 40 companies and about $1.5 billion worth of spending. And what I'm able to do is use that purchasing volume to go out to the market and get services that a smaller company wouldn't. For example, Neiman Marcus, 3,000 or 4,000 employee company, now goes to the market as a 150,000 employee entity. We're then able to do these RFPs and kind of choose national vendors that are willing to do things the Equity Healthcare way. And what I mean by that is we're not buying an Aetna or United Healthcare product, off-the-shelf product at a discount. What we do is at a discount, we ask them to customize care using their employees and their systems in a way that they haven't done before. We think there's a lot of opportunity to save money out there, but insurers in general don't have a lot of demand from employers to innovate, but we're very innovative. Well, it's changing really rapidly, obviously, with the passage of the healthcare reform bill 3 years ago. I think the government really took a very dominant role about kind of setting kind of themes and aims and goals for the system. And so really we haven't seen that, certainly in my several decades. So I think the public sector has taken a much bigger role. Now understand the way they did the reform was still working through the private sector. So they're not government hospitals, they're not government insurance, they're working through the private sector. But they've taken a bigger role. I think that's a good thing. I think to the extent that they kind of set the rules for the marketplace, kind of set the rules that it's a level playing field and let the private sector innovate, I think that's good. On the private sector side, let me talk about employers, which is kind of where I work. It's been the biggest change probably since the passage of ERISA back in the early 70s. That's like 40 years. And it's a big change really for two reasons. The first is it says to employers, you no longer are free to not cover employees. You know, you must either cover them or pay a fine. That's unprecedented. And the second thing is it offers employers a way out. So these health insurance exchanges or marketplaces are going to be set up. So employers who maybe didn't want to offer health benefits but didn't want to throw their employees to the wolves of a non-functioning private market can now say, listen, employee, this isn't what we do. You're going to go to the marketplace and buy your insurance there. So it's really the biggest change in 40 years on the private employer side. Asking me as someone who runs a company on the employer side, it's really, in a sense, taken the oxygen out of the room. So I'm very intent on innovating and driving quality and all sorts of different approaches to managing healthcare. And I meet with the CEOs of all these companies, and what they want to know is about health reform. What do I do? You know, what does this mandate mean? Should I stay in? Should I go out? So it really has taken center stage. It's been around for a few years, but most CEOs are busy, and so it wasn't until they finally had to make decisions that they faced it. So it really is issue one. I think the good news for my company is they're almost all going to stay in the system and not bail. So, but it's a good opportunity to use it as a way to be innovative, to basically say, look, healthcare costs are not going to magically disappear. You don't have a magical exit strategy. You have this Cadillac excise tax coming up that you're going to be judged in how you do in 2017. So now is the time in 2013 to get really innovative and aggressive about what you do. So over 2014, 2015, 16, 17, you lower your costs enough and save yourself money. So, you know, it's kind of, you spend the first 40 minutes of the hour talking them down from the ledge about health reform, and then the next 20 minutes they get very intent and very interested in driving innovation. the healthcare system is so vast and so complicated that there's always this tendency, why don't we centralize everything and make things simpler like a Canadian system? And there actually is a lot to be said for that in terms of decreasing administrative complexity. It is so complicated for patients and individuals to figure out what's happening with their benefit design. The problem is when you do that, you really kind of stifle innovation. The other side of the curve, of course, is you let I guess in the case of healthcare, 1 trillion flowers bloom, and it just becomes chaos. We saw this in the quality measurement movement probably 10 or 15 years ago, where finally the system decided it was going to measure quality, it was going to make it transparent, and literally hundreds of different methodologies to measure quality rose up. It drove the hospitals and doctors crazy because there was no kind of coordination or unanimity, and so that doesn't work either. So it really is kind of almost you need both centralization and decentralization. And so my bias is I believe that the market makes a big difference, but the market needs rules. So IT, we need rules. We still don't have interoperability because we can't decide on basic rules about language, fields, etc. That needs that. I think governments have done a good thing in making those precious metals and exchanges, the bronze, platinum, gold, and silver plans. So I think setting a level playing field in the market and setting rules that allows the market to work, that needs to be centralized. I think at that point you ought to let the market work and be decentralized around service innovation, around all sorts of payment reform innovation. So I think it is we don't know how to do this. I mean, this is a vast sector. So to say you should have centralization and decentralization and figure it out, pretty easy to roll off your tongue, pretty hard to do, and all of us in healthcare will spend the rest of our careers trying to figure out the balance.